Have you ever wondered about the wonders of your body? A question like, when your hands are numb, your hands are weak, is it necessary to massage your hands to reduce the pain? Is there any point on the body that when pressed can also help reduce numbness and pain in the hands? Today, I will help you learn about things you do not know about the human body, specifically the treatment of numbness and pain in the hands of the elderly and young people with early degeneration. Numbness and pain in the hands is old-fashioned. Today, we will find the acupuncture points that connect to the hands. Before that, we still have to mention the cause of numbness and tingling in the hands. Numbness in the hands and feet is a fairly common phenomenon, often starting silently with a tingling sensation like a needle pricking, tingling like a slight electric current running through. At first, you may only feel a slight numbness when sitting for a long time, lying on your side, or working in the wrong position. However, over time, this numbness can spread, accompanied by an unusual burning, cold sensation, or complete loss of sensation in the fingertips and toes. Prolonged numbness in the hands and feet can have many serious consequences. The patient may have muscle weakness, reduced ability to grasp, difficulty walking, or even complete loss of sensation if nerve damage is not treated promptly. In some cases, the patient cannot feel temperature or sharp objects, which can easily lead to burns, scratches, or falls without knowing it. Early detection combined with proper rest, gentle exercise, acupressure, micronutrient supplementation, and specialized neuromusculoskeletal examination will help patients prevent unwanted complications. Have you ever thought that pressing a certain point on the back of your neck can help treat hand pain and numbness? Let's learn about an acupuncture point called the Feng Qi point. Although the Feng Qi point, GB20, is not located on the hands or feet, it plays a very important role in treating numbness in the hands and feet, especially when the cause comes from the neck or central nervous system. Pressing the Feng Qi point helps relax the neck muscles, increase blood circulation in the cervical spinal cord, reduce nerve compression, helps improve numbness in the hands, and more seriously, numbness can spread down to the legs if the central nervous system is affected. The Feng Qi point is located on both sides of the back of the neck, in the depression between the sternocleidomastoid muscle and the trapezius muscle, right at the base of the skull. To easily locate the point, spread your hands, place your palms on top of your ears. The fingers hug your head, and the thumbs point towards the back of the neck. Stroke your thumbs down through a bony ridge to the depression between the two muscle blocks at the back of the neck. That is the location of the Feng Tri point. How to press the Feng Tri point? Prepare a comfortable sitting position. Relax your body. Use your thumbs to press the point clockwise with moderate force for about 2 to 3 minutes. Do it regularly every day for best results. The Feng Tri point is not directly located on the hand, but it directly affects the place that controls and transmits signals to the hands and feet. Therefore, this is one of the important points that need to be combined when treating numbness in the hands and feet due to neurological causes, degeneration, or poor blood circulation. If you have numbness in your hands and feel that the cause comes from the neck and shoulder area, listen and learn about the following acupoints. Second, Junjing Acupoint. Junjing Acupoint is located at the midpoint of the line connecting the C7 cervical vertebra to the shoulder tip, at the highest depression on the shoulder. This is an easy-to-determine position. The effect of Qian Tin Acupoint will reduce stiffness in the neck and shoulder muscles. Stiffness in the neck and shoulder area can compress the nerves, causing numbness in the hands. Pressing Junjing Acupoint helps relax the muscles, reduce pressure on the nerves, thereby reducing numbness symptoms and promoting blood circulation. We determine the location of the acupoint by sitting up straight, relaxing the shoulders, Determine the midpoint of the line connecting the C7 cervical vertebra to the shoulder tip at the highest depression on the shoulder. Use your thumb or index finger to press on the acupoint with moderate force, rotating in a clockwise direction for about 1 to 2 minutes. In addition to its effect of reducing numbness, Tin acupoint is also used to treat diseases such as neck and shoulder pain and headaches very effectively. Have you ever thought that the kidneys are also connected to the limbs, like pressing the area around the kidneys to stimulate the legs or arms? If you have ever wondered like that, we will immediately learn about an acupoint below. Third Shen Du acupoint. The Shen Du acupoint is located in the lumbar region at the level of the second lumbar vertebra, L2, about 1.5 inches from the midline of the spine, equivalent to the width of 2 fingers put together. This acupoint is very useful in treating numbness in the limbs due to causes related to poor blood circulation, weak kidneys, or long-term degeneration. You can determine the acupoint by determining the L2 vertebra. Place your hand on the top of the 2 iliac crests, hip bones. The midpoint of the line connecting these 2 peaks usually corresponds to the 4th lumbar vertebra, L4. From there, count up 2 vertebrae to determine the L2 vertebrae. Determine the Shen Du point. From the L2 vertebrae, measure horizontally to both sides about the width of 2 fingers together to determine the location of the Shen Du point. To effectively press the Shen Du point, you can follow these steps. You can lie on your stomach or sit up straight and relax your body. Use your thumb or middle finger to press the point with moderate force, rotating in a clockwise direction for about 1 to 2 minutes. Perform acupressure 2 to 3 times a day for best results. Properly pressing the Shen Du point can effectively help reduce symptoms of numbness in the limbs, especially when the cause comes from kidney problems and poor blood circulation. Although the above 3 points are not located in the hands and feet, they have an indirect and profound impact on the nervous system as well as blood circulation, especially in the neck, shoulders, and back, which are the starting points of the nerves that control movement and sensation of the hands and feet. When properly impacted, these points help increase the circulation of stagnant blood, thereby reducing pressure on the nerve roots. Regularly combining these 3 points creates a comprehensive therapy, supporting the treatment of numbness in the hands and feet in a sustainable way from root to tip. If you know of any other acupressure points that are effective in treating numbness and pain in the hands and feet, please share them in the comments section below. Please share this video with your relatives and friends who are having problems with numbness in the hands and feet to help them solve their health problems. If this video is useful, please click to follow the channel to learn more methods to heal the body without using drugs.